I would like to ask you permission to use this video for educational purpose and on internet.
Yes, fine.
Now, tell me first about your symptoms before the surgery.
Well, before surgery, most of my symptoms were on the right side of the base of my spine. It was a very irritating, irritated nerve pain, and that spread down my leg a ways. And most of the problem in my leg and foot was numbness. It just became numb.
Yeah.
It did come with some pain on the outer side of my leg that went all the way down to my ankle. And that would get, depending upon my level of activity, that would be burning and quite painful sometimes.
How long did you have that pain?
Well, that pain built up. I began having symptoms about 4 years before that, and within a year and a half after I started feeling symptoms, and that pain took over. So I'd say 2.5 years of
2.5 years bad pain.
Right.
Now, you did obviously some non-surgical treatment and they didn't help you, is that correct?
That's correct.
And tell me, you saw some other surgeon, without calling any names, tell me, what did they tell you? Tell me the same thing you just told me 5 minutes ago.
Well, that particular surgeon said that I should try steroid injections. I should try physical therapy.
Which you did?
Which I did, and nothing really helped. As a matter of fact, physical therapy aggravated the condition. And he said that if he were to schedule surgery, he would do an open procedure. In his words, he would do terrible things to me.
So he told you that. That's,
right.
And I think I hate to say that he wasn't wrong.
It was a matter of, he described debriding the muscles, taking the muscles away, and losing a lot of tissue and building a large cage around it and so forth. And the procedure didn't seem very appealing, but I was almost ready to say go ahead and try
because the pain was bad.
Because it was disabling.
Now, comparing to what you heard about the surgery that he described quite correctly, we did our surgery just 4 months ago, correct?
Right.
How was our surgery?
Well, it certainly wasn't what he described.
Okay. Now, first of all, let's start with easy ones. How long did you stay in the hospital?
24 hours.
Okay. When did the leg pain get better after our surgery?
The leg pain went away as soon as, after surgery it was gone.
So you woke up and the pain was gone?
Right.
Okay, and so far we're good. Now, what about the back pain?
The back pain took a little bit longer. Of course, there was, the trauma of the surgery.
Yeah. So you woke up and you noticed pain is different.
Right, pain was different.
Yeah.
It didn't have that feeling of irritation, direct irritation of a nerve. It was sore, and it was, I felt the incision and so forth, but it was less severe.
No.
And for the back pain to pretty much go away was 3 weeks, maybe.
3 weeks.
Yeah.
How long did you take, heavy medication after the surgery?
Oh, I took medication for 8 weeks.
8 weeks.
But
I did reasonable.
I never took the full dose of medication that was recommended. All the labels said this dosage as needed.
Yeah.
And I didn't feel like I needed it.
Excellent. Good common sense. Dealt with that very correctly. Now, I'm going to turn around and show what we did. So this is your back. We did a 2-level fusion. And look at that. Just 4 months later, the bone is already growing in all areas. And as well in the lower region, bone is beautifully growing. And this is pretty good for 4 months. There's another thing I want to show here, that you have a scoliosis. We decided not to fix everything because another surgeon may have fixed all the way from your chest area down to your pelvis, and he would not have been wrong doing that, because that is sometimes what we do to correct your condition. But we identified only 2 of the segments were giving you most of your problem. The side bending of the spine is corrected in that 2 segments. As a matter of fact, in that segment we corrected your side bending is only 3.5 degree, which is almost nothing. And we chose doing that instead of a big surgery. And what you are describing to me, we made the right decision because we didn't really need to do that horrendous surgery from chest down to pelvis to fix your problem. We fixed only 2 of the levels, and you went home next day Our surgery was less than an hour, and we lost about 1/5 of a cup of coffee blood. That's all what we lost.
Okay, good.
Now, so far, happy with the result?
Yes, I am.
Good,
Yeah, I'm happy
good.
with the results.
Now, we still have some symptoms in your leg, that your leg's still weak and it's recovering, but we have to do physical therapy. We are not done. We are just 4 months after that big surgery.
Right.
Now, what made you wait that long? 4 years is a long time to be in this kind of pain.
Well, I kept going to doctors, and they would send me to some physical therapy. They would say try a steroid injection, try different things. As a matter of fact, during that time, I had a microdiscectomy,
Oh, okay.
and
So,
then someone said there's a cyst there, and let's remove the cyst.
did it help you?
Very little,
Very little.
very little. So I went through that recovery,
Yeah. Yeah.
and then well, I'm funding this all through the Veterans Affairs Department, and there was some procedure to go through to get it approved.
Yeah,
So
yeah.
that lengthened the time.
Absolutely, absolutely. But no, I'm happy. I mean, the walking, the understanding is getting better. Is that correct?
It is getting much better.
Tell me about it. What's it? Your daily activity different now than 6 months ago?
Oh, well, 6 months ago, it was 2 months before surgery. I was aware that just walking or ordinary activity was certainly not normal. I would get cramps in different muscles around the base of my spine on both sides, because I was trying to compensate
Yeah.
and find some way to walk that allowed me to go from one place to another without my leg going entirely numb and without extreme pain. I would go out and before this got bad, I had been in the habit of walking 45-50 minutes a day just for general exercise.
Yeah, that's a good exercise, actually.
And I would try to maintain that, but I'd go out and walk. I guess I timed it out to about 12 minutes is all I could stand, and I'd be trying to get back to the house, gritting my teeth and sweating
Yeah.
because of the pain, and my foot was flopping like a board.
Yeah. How's that now?
Oh, I'm still not walking quite normally. The left side is trying to. All of what's back there is trying to get used to the new normal.
Yeah. Yeah.
And so it's
Well described.
I can feel it adjusting and adapting. But I started out, of course, right after surgery with a walker, and felt very uncertain of how to move. And there were times, of course, when I'd say, for example, try to turn one place to another, and my right side would say, okay, let's turn, and my left side would say, well, wait a minute, how did we used to do that? I don't remember this.
Yeah, so you're relearning daily activity.
Right.
Good. Now, many people who go through this process become an expert in this because they have to live it.
Yeah.
What advice do you have for somebody in the same situation, or for yourself a year ago? What advice would you give people in this situation?
I guess the only advice would be, be your own advocate, be your own proactive advisor.
Do you know what I would advise give? Informations are out there. Go
Right.
seek information.
That's one thing too. I have a tendency to, if I encounter something of a medical nature that I'm not sure of, one source I consult. Everybody can go online and go to various websites.
Yeah,
They'll tell you
yeah.
almost anything you want to hear.
Yeah.
But I have a tendency to go to the Mayo Clinic website
Yeah.
and see what information they have. And when I learned about this procedure, and I went to the Mayo Clinic website and found out that this is, apparently now their preferred procedure.
They don't do that. They don't do this. Yeah.
And
What do you have? What would you like to Mayo Clinic know?
oh well, I'd like to. Well, it works.
It works.
It works. Yeah.
So yeah, well, I think just being Mayo doesn't mean that you know everything. They're
That's
good
true.
at many things, but
Yeah.
nobody is good at everything.
Right.
So, and we offered to teach them actually.
No.
Yeah, but they haven't taken us on this offer yet.
Oh, okay.
Well, it is what it is. Many of the procedures are not invented in Mayo, but once they are good, Mayo takes over 5 to 15 years later.
Well, that's what I've heard, that they
Yeah.
they go
They're not
through
invented. They don't invent everything.
a long process of approval, and then eventually when they finally find out that this is a good thing, then it becomes their standard procedure.
Yeah, hopefully they start looking into this soon. Okay, send them a letter if you don't mind. Let them look into that. Well, any other question for me or comment?
That's about it. I think it's okay.
Well, thank you so much. That was really educational. Thank you.
I hope so.